All right, let's jump right in. Today, we're opening up the essential toolkit used by the real-life detectives of the medical world. Yep, we're talking about epidemiology. And together, we're going to crack the case on how public health experts track and stop diseases dead in their tracks. Let's get to it.
Okay, picture this. A strange illness starts popping up in a town. People are getting sick, and nobody has a clue why. You can feel the panic starting to build. The clock is absolutely ticking. Who do you even call? How do you begin to solve a mystery like this?
That's when you call in the big guns, the epidemiologists. They are the elite investigators of public health, the ones who get on the ground, start gathering clues, and piece together the entire puzzle of an outbreak.
So what is epidemiology, really? Well, at its heart, it's the science of asking three super important questions. Who exactly is getting sick? Why them? And, the big one, what can we do to get this whole thing under control and stop it from spreading any further? Now, any good detective worth their salt needs a plan, right? A playbook to guide their investigation. For an epidemiologist, that plan is their mission.
So let's look at this playbook. First, they have to identify the cause. You know, the whodunit of the disease world. Second, they measure the frequency. How many people are we talking about here? Third, they study the distribution. Who is getting sick? Where are they? And when did it start? Once they have that intel, they can move to step 4, planning how to actually prevent and control the disease. And finally, they circle back and evaluate their own health programs to see if the plan is actually working.
And here's a little pro tip for you, a really key takeaway. If you ever want to know if something is truly epidemiology, just ask yourself, does it involve planning, prevention, and control for the health of a whole population? If the answer is yes, you're looking at epidemiology in action.
Okay, so our detective is on the scene. First thing they have to do, assess the situation. Get the lay of the land. Is this a small, contained incident, or are we looking at a citywide crisis? For disease detectives, that means measuring the outbreak.
The very first tool they pull out of their kit is called Incidence. This one counts only the new cases that pop up during a certain window of time. Think of a sudden dengue fever outbreak. Incidence tells us how fast this thing is spreading and what your personal risk is of getting sick, like right now. It's basically the live breaking news ticker for the disease world.
The second tool is Prevalence. Now, this isn't the breaking news. This is the bigger picture. It's the total number of cases, all of them, old and new, at one specific moment. This is super useful for understanding the overall burden of chronic diseases. Things like diabetes that stick around for a long time.
Okay, let's put these two side by side because it's super important to get this right. Incidence focuses on new cases to measure immediate risk, which is perfect for an acute outbreak. Prevalence looks at the total cases to measure the overall burden, which is way more useful for those chronic conditions. A good detective knows exactly which tool to use for the job.
All right, now we get to probably the most famous model in a disease detective's entire toolkit. To crack any case, you've got to identify your suspects. And in the world of epidemiology, there are always 3.
You see, a disease doesn't just happen. It's not magic. It's the result of a specific interaction, kind of like a perfect storm, between 3 key players. So let's meet the lineup.
Suspect number 1 is the agent. This is the what, the actual bad guy that causes the illness. It could be a virus or a bacteria, like Vibrio cholera, but it could also be a chemical or even a physical thing like radiation. It's the trigger.
Suspect number 2, the host. This is the who, the person or animal that gets sick. And all sorts of clues about the host matter here: their age, their immune system, their habits. For instance, a person with poor hygiene is a much more susceptible host for that cholera agent we just mentioned. And that brings us to our final suspect, the environment. This is the where. It's the external setting, the stage that allows the agent and the host to meet in the first place. This could be something like a contaminated water supply that lets cholera spread, or crowded living spaces where tuberculosis can just thrive.
So let's see how this triad works in the real world, because this is where it all clicks. For tuberculosis, the agent is the bacteria, the host is someone with low immunity, and the environment is a crowded living space. For COVID-19, the agent's the virus, the host is often an elderly person, and the environment is a crowded indoor space. For an outbreak to happen, you need all 3.
So, identifying the suspects is huge, but a truly great detective doesn't just solve a crime after it's happened, they stop it from happening in the first place, and that is where prevention comes in.
But to intervene in the right way, you have to get your timing right. Every single disease follows a kind of timeline, a natural history.
And understanding that timeline is the secret to stopping it.
And here's what that timeline usually looks like. It starts with a phase called pre-pathogenesis. This is before the disease even begins, when only the risk factors are there. Then comes pathogenesis. This is when the disease actually starts developing inside the body. And finally, you have the outcome, which could be anything from recovery to disability or worse.
So knowing this timeline gives our detectives a perfect roadmap for when to intervene. They can jump in at 3 different levels. Primary prevention happens before the disease even starts. The goal is to stop it cold. Think vaccines. Secondary prevention is all about catching it early through things like screening tests. And tertiary prevention happens after the disease has already done its damage, and the goal is just to limit the impact through things like rehabilitation.
Let's lock this in, because this is really key stuff. A vaccine is primary prevention. You stop it before it gets a chance. A cancer screening test is secondary prevention. You're catching it super early. And physical therapy after a stroke? That's tertiary prevention. You're managing the aftermath.
So there you have it. We've opened the Disease Detective's Toolkit. You know how to measure an outbreak, identify the 3 key suspects, and intervene at every single stage. So the question is, as you go about your day, what clues will you start to notice? What agents, hosts, and environments do you see interacting all around you?